Welcome to Shoulder Guide. Today we're discussing the differences between an anatomic shoulder replacement and a reverse total shoulder replacement. There's a few key differences that we'll discuss today. Let's start with the anatomic replacement. This is designed to mimic the natural components of your shoulder. A metal ball replaces the humeral head, and a plastic socket replaces the glenoid, or the socket of the shoulder blade. The anatomic shoulder replacement is used when the rotator cuff is intact, but the humeral head is arthritic. That is the key difference with this versus the reverse total shoulder. The rotator cuff is preserved during this treatment, so if you don't have any issues with your rotator cuff, no tears, they'll keep this intact and then just replace the humeral head. The anatomic replacement generally has more range of motion and strength because your rotator cuff is preserved. Now let's talk about the reverse total shoulder replacement. Essentially what this is reversing the position of the ball and socket of the joint. So the humeral head now becomes the socket portion and the glenoid becomes the ball portion. The reason why we reverse the positioning is to create more stability when the rotator cuff is not intact. Oftentimes, the patient will have a rotator cuff tear that can't be operated on, so instead we reverse the components to create more stability in this position. Instead of relying on the rotator cuff, the deltoid has a lot more responsibility with a reverse total shoulder. So to summarize, anatomic is when your rotator cuff is intact, and reverse is when your rotator cuff is inoperable. Both replace the components of the humeral head, which has the arthritic changes in it. The main feature is your rotator cuff intact and viable? This video is just a brief overview of both procedures. In future videos, we'll be discussing in more detail about the recovery process of both. Thanks for watching today, and stay tuned for more content.